following program does not necessarily reflect the views, opinions, or policies of the City of Oceanside, its elected officials, KOCT, its board of directors, or staff.
Community Health Matters was made possible by a grant from the Tri-City Healthcare District and with additional support from Tri-City Medical Center.
Hello and welcome to Community Health Matters. This show is dedicated to providing information regarding health programs and services that affect you. I'm your host, Ricardo Berron. Community Health Matters is produced by Tri-City Medical Center and KOCT and is available in English and Spanish. Check out koct.org for specific programs as well as replay times. We have a great show for you today, so let's get started. There's no doubt that the Affordable Care Act has introduced significant changes in the U.S. healthcare system. Starting next year, most people in the U.S., with very few exceptions, must have health insurance, and no one can be turned down because of a medical condition. In today's show, we will provide an overview of how health coverage works in compliance with the new law and how it can affect you. To help us with this task, we have Mr. Wayne Knight, Executive Director of Healthcare Reform and Contracting at Tri-City Medical Center. Mr. Knight, thank you for being here with us. First things first. How would you explain to someone that is currently uninsured the importance of having healthcare insurance?
Well, you know, healthcare is very, very expensive, and I hope everybody realizes that, but if people don't, let me give you a couple examples. If you're delivering a child in a hospital, that stay, depending on the complications, can cost anywhere, and I'm talking about the cost, the bill, between $11,000 to almost $20,000. God forbid if you have a heart attack and you're admitted, that bill can run anywhere between $90,000 to maybe almost $500,000 depending on complications. So just like someone wouldn't want to walk around without homeowner's insurance or renter's insurance, or you can't drive without car insurance, it's really a smart move to have health insurance to avoid getting these type of bills.
Yeah, it makes sense. Now, can you please walk us through the key components of health insurance coverage, like premiums, deductibles, co-payment, co-insurance?
Sure. Premiums are what you pay every month, and people are familiar with that if they're paying mortgage premiums or fire insurance premiums. Deductibles are what you pay out of your pocket towards your total cost of care, and it's what you pay before insurance kicks in. Co-insurance is what you pay when you go to see a physician, where you pay a co-pay of say $20, $25, and the insurance pays the rest. And there's also under this law an important new provision, which is the maximum out of pocket that someone can pay over the course of a year. So when you combine your premiums, or excuse me, when you combine your co-pays, when you combine your co-insurance, you have a maximum that you can pay out a year, which is about $6,300.
So what are the new benefits, rights, and protections included in the Affordable Care Act?
Well, one of the most important things is that you cannot be turned down for insurance anymore. Whether you have pre-existing conditions or other type of history, you cannot be turned down. If you have children and you have insurance already, they can stay on your plan until they are 26 years old. So 25 years and 11 months, they're still on the plan. There are limits on how much you could be charged for insurance under the exchange. There's a ratio for a young adult to a older adult that's 3 to 1. So you cannot charge older people more than 3 times what you charge the youngest and the healthiest. And of course, very important is the lifetime maximum that you can ever pay has been eliminated.
So now, Mr. Knight, can you explain the 10 essential health benefits that all private health insurance plans will have to offer?
Certainly, and because this is so important, if it's all right, I actually have a list and I want to make sure I get it right.
Yes.
The 10 things that are guaranteed under the exchange, and anybody that offers insurance under the exchange, include preventive and wellness services and chronic disease management. These are services you would get when you see your doctor. Prescription drugs are covered, emergency services at a hospital or a urgent care center, hospitalization, outpatient visits like going to get a mammogram, rehabilitative services and rehabilitative devices, laboratories covered, mental health, substance abuse, and actually including behavioral health treatment, be it inpatient or outpatient, maternity and newborn care, and finally pediatric services, including dental and vision care for people under the age 19.
Wow, pretty wide coverage there. What financial help does the federal government offer to people who cannot afford to buy healthcare coverage?
Well, there's numerous programs. Most prominently discussed these days is that there are subsidies for people depending upon their family size and their income that can go to be used to offset the cost of the premiums. And what's interesting is the subsidies are paid directly to the insurance company. So it's not a matter of they send you a subsidy, you have to then pay the full price. Subsidies go straight to the insurance company. The other thing obviously is that Medi-Cal has been expanded in the state of California significantly, so there are numerous opportunities that did not exist in the past for that.
And will there be any penalty for not having health insurance?
Yes, there are. Unless you fit some of the narrow definitions of people that are excluded, every person in this country must have health insurance. If you don't, you have a penalty that's roughly 1% of your income or $95 per person with a family limit of $245. So that's the penalty if you do not have insurance.
Wow. Mr. Knight, thank you so much for this vital information. We have to take a quick break right now, but as soon as we get back, Mr. Knight will tell us more about the health insurance marketplace, also known as the exchange, and how to utilize this tool to find the best insurance plan for you. This is Community Health Matters, and we'll be right back.
Sodas, energy drinks, sport drinks, and other sugary beverages raise blood sugar levels, and just one serving provides several hundred calories. That's why, to help prevent diabetes, the American Diabetes Association recommends limiting the intake of sugar-sweetened beverages.
Just one more inning, Grandma!
Ever notice how many things today kids can do without actually moving? A whole lot of things their parents used to do the hard way. So many kids' activities today seem to leave out the activity part, which makes exercise even more important for children. In fact, new research tells us the best time to enhance bone development is during childhood and adolescence. And just getting children to walk an extra 35 minutes a day could spare them the pain of thinning bones later in life. Healthy bones come from healthy habits. Encourage your kids to get up, get out, and get moving.
Hello. Hey, Grandma, how about another grape soda?
A public service message on building strong bones for kids from the Pediatric Orthopedic Society of North America and the American Academy of Orthopedic Surgeons.
At what age is the color that your skin was meant to be no longer beautiful? Every year, millions of young women try to change the skin they were born with and say they die for darker skin. Sadly, some actually do. Melanoma is the second most common cancer in teens and young adults, and one person dies from melanoma every hour. Change your thinking, not your skin. Stop tanning. Learn more at spotskincancer.org. A message from the American Academy of Dermatology.
In the event of a car crash, 3 out of 4 kids are not as secure as they should be because their car seats are not used correctly. But the latch system makes it easier to get it right and to hold your kids tight. anchor, tether, latch. Learn more at safercar.gov.
Welcome back to Community Health Matters. I'm your host, Ricardo Berron, and I'm joined by Mr. Wayne Knight, Executive Director of Healthcare Reform and Contracting at Tri-City Medical Center. We're discussing the changing state of health insurance, and Mr. Knight is here to help us understand it all. Whether you don't have coverage or you do, but want to look at other options, the health insurance marketplace, also known as the exchange, can help you compare your options and find out if you can get lower rates based on your income. According to official sources, the marketplace is estimated to provide up to 29 million people with affordable health insurance by 2019. In this segment, we will learn more about this tool and how to utilize it. Mr. Knight, plans in the marketplace are separated into 5 categories: bronze, silver, gold, platinum, and catastrophic. How do they work?
You know, that's a very good question. The metal analogy used here relates to the amount of money that you will have to pay out of pocket. So if you choose a bronze plan, you're generally going to be responsible for about 40% of your healthcare costs, and the insurance will pick up the 60%. Moving along to silver, the insurance will pick up roughly 70%. Gold will be roughly 80%, and the highest one offered, platinum, covers about 90% of the cost you would be expected to incur over the course of a year. Obviously, all these percentages stop when you've hit your maximum out of pocket for the year. The other one you mentioned is something we really don't hear a lot about. It's kind of been invisible. It's the catastrophic plan. That's really limited to 2 categories of people. If you're under 30, you can buy that. And if your health insurance costs are greater than 8% of your actual income in the course of a year, you can also apply for that. So those are really the main categories, and it's consistent across the country. So that was one of the standardization features that they took a lot of effort to implement.
Well, now that we know the cost, how can people apply for marketplace coverage?
Well, there's a lot of opportunities there. In California, the website here is coveredca.com, so you can go on there, and obviously that's subject to the same kind of interruptions and glitches that have happened everywhere else, but it is actually up and functioning. You can download the paperwork actually from that website, submit it that way. You can go on their toll-free number and talk on the telephone. You can also still work with your broker if you have one. Obviously employer insurance is still there, and various other government subsidies are still there as well.
Can my application be denied?
It cannot be denied if you have pre-existing conditions. Your application, if it includes a subsidy request, can be denied if you don't meet the criteria. And obviously an incomplete application can be sent back. But generally you will not be denied care if a successful application is submitted.
And what about any dental coverage plans in the marketplace?
Well, there are freestanding dental plans in the marketplace, as there always have been. These really aren't components of the exchange unless you're under 18, in which case there is a pediatric component to that. But going forward, dental insurance is something that people can make choices about, purchase or not purchase, not part of the law.
Is the exchange the only place you can shop for health insurance?
No, you can use your an individual broker if you're comfortable with that, or if you've already got something like that going. And obviously there's employer insurance that still is out there in the government programs as well.
So will things be different in 2014? Let's say, will health insurance cost more than, or what will happen to my current health insurance plan? Will I be able to change plans?
Well, those are great questions, and let me tell you a couple things about that. Number one, health insurance costs for 2014 aren't known, 2015 aren't known yet. We know what the cost for next year is going to be.
Yeah.
But if the marketplace fails to attract all the young and healthy people, what you currently hear called the young invincibles, then it's very likely insurance will go up in the following years, because it's really the healthy people that subsidize the sicker people in that regard. The other thing is that, as everyone's probably familiar with or may have heard, the employer mandate was pushed back a year. So what you're seeing now, where people with individual coverage are getting canceled because their policies don't meet the exchange minimum. Next year, what we're worried about is that employer plans that are these, what we call bare bones or close to catastrophic, if they don't meet the requirement, then you'll have employers dropping plans as well. So your employer insurance and your individual insurance can change in the next couple of years.
Do I need to be on the same plan as my spouse, let's say?
Actually, you do not. As long as you have insurance that meets the criteria, regardless of where you obtain it, you do not need to be on the same plan as your spouse, or if you have children, they can be on a separate plan as well.
Will there be such a thing as Obamacare only doctors?
An interesting question. I don't think there will be Obamacare only doctors. What my issue will be is I think there are a tremendous amount of physicians that are anything but Obamacare. So you might have a primary care or specialty care physician you're using now that you're comfortable with, that in the future may not be part of this exchange. So that's something people have to be very careful about and very cognizant of when they look to choose a new plan.
So now, can you explain how is the rollout going here in San Diego?
Well, obviously in San Diego, it's part of the Covered California initiative. Okay. So it's really a statewide initiative, no different in San Diego than, say, Los Angeles or Northern California. What we understand is our website's one of the better functioning websites, and the Covered California is going to release numbers, hopefully by county, sometime this month.
Well, thank you. Now we have to take a short break right now, but again, lots of great information from Mr. Wainwright. In our final segment, we will discuss the various benefits that come with your health plan if you're a senior citizen, unemployed, or a veteran. Stay tuned for more of Community Health Matters.
Washing our hands regularly may be the single most important action to prevent diseases. Proper hand washing involves using clean soap, rubbing and scrubbing for 10 to 15 seconds to effectively remove the germs, rinsing the hands completely, and thoroughly drying them.
If you could see anything in the world, what would it be?
I'd love to see Paris. I like to see cupcakes falling from the sky.
My daughter, married and happy.
I want to see things the way I used to.
Chances are, someone you love may one day be affected by macular degeneration or glaucoma. Log on to seeabettertomorrow.org or call 1-800-437-2423 to learn about glaucoma and macular degeneration. Call 1-800-437-2423 or log on to seeabettertomorrow.org.
I just want to see more of the things I love.
Fruit. What a tasty treat. Fruits packed with potassium and other nutrients can help keep your heart pumping strong during the game. And they give you energy back so you can take on the next activity. Can your food do that? Run, throw, think, eat better. Find out more at smallstep.gov.
Learning the art of fly fishing is learning a sport for life. Fishing reduces stress and it inspires the spirit. For women with breast cancer, it also promotes physical and mental healing. At Casting for Recovery, we believe to fish is to hope.
An opening of the mind and a renewal of spirit. It's been all those things. They really accomplished the goals that they set out to accomplish, and we did too.
To learn more about Casting for Recovery or to make a donation, log on to our website.
What if a disaster strikes without warning? What if life as you know it has completely turned on its head? What if everything familiar becomes anything but? Before a disaster turns your family's world upside down, it's up to you to be ready. Get a kit, make a plan, be informed today. Learn how at ready.gov.
Cassandra Mearsong. Stephanie LaCastro.
Excuse me. Have a seat, babe.
Have a seat.
No, hold on.
Right. Take off the jacket. All right. Sorry.
2 out of 3 people with diabetes die of heart attack or stroke. That was his wake-up call. This is yours. The good news is, you can lower the risk of heart attack or stroke.
Sir.
Ask your healthcare provider how. To learn more, go to diabetesactnow.org.
Starts here.
In nearly 600 communities nationwide.
People are stepping up. People are stepping up.
We are walking to end Alzheimer's.
We're recruiting our friends.
Who are recruiting their families.
Who are recruiting their co-workers.
We're raising awareness.
And raising donations.
To care for those living
with the disease. To advance research.
To support all
who are affected.
Together we can put an end to the
nation's 6th leading cause of death.
We're stronger together.
Together we can reclaim our future.
It's easy. The end of Alzheimer's starts here.
Lead the way.
Walk with us.
Walk to end Alzheimer's.
Welcome back to Community Health Matters. Our final segment for today is about the various benefits you may be eligible for. Whether you're pregnant or a senior citizen, unemployed or a military veteran, you may have different needs and be entitled to different benefits when it comes to your healthcare coverage. So that's why Mr. Wayne Knight of Tri-City Medical Center will guide us through these matters and answer some questions about eligibility. Thank you for sticking with us, Mr. Knight.
My pleasure.
Who is eligible for healthcare coverage through the health insurance marketplace?
Well, anyone that is not covered by an employer plan, or anybody that's not already on a government plan such as Medi-Cal, Medicare, VA, they're all eligible to participate regardless of their age or their health conditions. And there's something very important here I want to mention, because I get asked this a lot. If you are eligible for Medicare, you cannot go on a health insurance exchange. As a matter of fact, it's illegal for someone to try and sell you a health insurance exchange product, because Medicare is already a product in the marketplace that works, and the people that are eligible for it were not considered to be in the exchange pool. So very important. If you're a senior citizen or if you're eligible for Medicare in any way, shape, or form, the exchanges are not part of your mindset.
So another question will be, what are the health coverage options for someone, let's say, who is unemployed?
Well, an unemployed person can still pick up insurance through the health insurance exchanges. Its subsidies will probably be much larger if income is that small. So I'm talking about not only unemployed, but say underemployed. And obviously there are many government safety net programs that are out there, and for military and ex-military, there are the VA, Champus TRICARE, TRICARE for Life are all programs that work for people regardless of their income or their employment situation.
Now, can you please explain how does the new law affect young people?
Yes, that's an important question. There's several ways that it impacts young people. First of all of them will be required to actually have insurance, where in the past they may not have been insured. Secondly, for young people who are in college, it's important to understand that the plans generally offered on a college program do not meet the Obamacare or the health insurance exchange minimum. So they'll need to have insurance that matches those requirements. But one of the important benefits is that anybody under the age of 26 can stay on their parents' policy so long as their policy meets the exchange minimum, or they can stay on their parents' exchange policy. So options for coverage have been greatly expanded for young people.
Here in San Diego, we have a huge military community. What do military veterans need to know about the marketplace?
Well, one of the first things that they need to know is that, again, if they are eligible under Champus, their family's eligible under Champus TRICARE or TRICARE for Life, or the VA, or any of those military-specific programs, or military retirees or military family, they have to go to that first. And so long as they're eligible for one of those products, that's where they obtain their care and their coverage. If they're not eligible for those, they are participating in the exchanges just like everybody else.
And what do the healthcare networks under the exchange look like? Are they big? Are they small?
You know, that's another excellent question, and something that I try and mention to people as often as I can. In San Diego, there are 5 insurance companies that are marketing a product. However, not all physicians and not all hospitals participate in all 5 of those products. So you have a program brought to you by Sharp that's obviously going to be limited to Sharp physicians. The Kaiser option is going to be limited to physicians associated with Kaiser. And then you have the private players like Anthem Blue Cross and Molina and others, and they're going to have networks specific to their product as well. So you may find that although the Blue Cross premium is the optimal premium for you, you need to check to whether or not your physician is actually participating in the Blue Cross product or your hospital. And one of the issues out there is that the website is not designed to let you figure that out beforehand. So if you have a network or a physician or medical group that you're using, you need to inquire from them as to whether or not they're participating or taking certain products.
And let's also not forget about retirees who are not eligible for Medicare. What about them?
They are fortunately eligible for every exchange product out there and for any of the other government programs that are available.
Please describe what is the Children's Healthcare Insurance Program, CHIP, and who is eligible to benefit from?
CHIP is a program designed for people 18 and under, children 18 and under, that their family income may be too high to qualify for Medi-Cal, but still not high enough to affordably purchase insurance coverage. So it's a product designed as kind of a safety net between Medi-Cal and the private pay market.
And let's say U.S. citizens living in a foreign country may wonder if they are required to get health insurance. What can you say about them?
Well, there's a couple of things. If you live in a foreign country more than 330 days in the course of a year, and I don't know where they get this number, okay? Because that means you can come here 35 days out of the year. But if you're a resident outside of the United States more than 330 days a year, you are not required to purchase health insurance. And if you are a resident in another country and you're not required to file income tax returns, you also do not have to purchase health insurance.
Wow, great information. Well, that's it for our show. Thank you, Mr. Knight.
My pleasure. Thank you very much for having me.
I'm sure all our viewers learned something helpful here today. And remember to mark your calendars as the new health coverage starts January 1st, 2014, and open enrollments end March 31st, same year, 2014. If you'd like to rewatch this episode of Community Health Matters, be sure to check out koct.org for replay times. You can also watch this program on the website, your iPhone, or your tablet. Share it with your friends and loved ones. This is vital information and worth sharing. I'm your host, Ricardo Berron, and this is Community Health Matters.
We tend to think of vaccines as an infant necessity, but immunization is as important for older children and adolescents. The American Academy of Pediatrics recommends hepatitis B, hepatitis A, polio, measles, rubella, and mumps vaccines between the ages of 11 and 19 for those who have not received the full dosages.
Community Health Matters was made possible by a grant from the Tri-City Healthcare District and with additional support from Tri-City Medical Center.